my personal health journey began shortly after I graduated from my master's program in nursing. I was working as a hospitalist, and I developed some health conditions that I had never had prior to that. I had been previously pretty healthy. I, of course, sought the conventional treatment as anybody would. I saw my primary care, who ordered some different testing, and the testing came back initially that there was some metastasis in my spine, which is, most of you know, is cancer that had spread to the spine. So I did more testing and some waiting, a lot of waiting, and found out that that was indeed not cancer, but rather a lesion in my spine. We were not able to determine if that was the source of a lot of my problems at the time. So I did see a neurosurgeon, multiple neurosurgeons actually, who determined that that was not causing the symptoms that I was having. So from there, I, of course, saw my primary care doctor. He did send me to pain management. I went through that pathway of injections and multiple nerve ablations and different procedures just to try to alleviate some of the symptoms that I had. Those were all unsuccessful. So I ended up back in my primary care office at that point, and during this time I was on different medications and things to try to alleviate the pain. I was then sent to neurology because they began thinking that maybe I had a neurological condition such as MS, and I underwent another series of tests that took quite some time, and those ended up coming back fine as well. There was no neurologic conditions and certainly not any MS. So neurology, when they cleared me, I was sent back to my primary care. So he did send me to rheumatology as kind of a last-ditch effort to figure out what was happening. I saw rheumatology. They did another set of testing that had not been done, and all of that testing came back as normal as well. So during this time, my condition had deteriorated. I had a lot of symptoms that kept me from doing the things that I enjoyed. My family and I were most impacted. I had 3 small children. I was unable to do anything with them that I wanted to do, and they were very active, of course. I was still working, but I had a very poor quality of life and was limited to the amounts of time that I could work. My sleeping was really awful, and I had changed jobs and was doing some more stressful work at that time, and that was certainly part of the problem, but I didn't know that at the time. I was also on many medications by that point that I took from the time I woke up until the time I went to bed, and that was kind of how I made it through the day. So it was certainly less than ideal, and I was only in my 30s, so I knew at that point that something had to change. I just wasn't sure what. That's when I began looking to find answers for myself, because I had gone that conventional medicine route, and my physician was basically, all the physicians I'd seen were unable to help me, and basically at one point I was told that what was going on with me was in my head, and there really was nothing that was going on because they couldn't find anything substantial. So I thought there had to be a different way, and I started researching different things on my own. I found integrative and functional medicine, and I was very intrigued by that. I didn't know anything about it at the time. As I began reading about it and learning about it, it made sense to me that looking at something that's going on with a patient from a big picture and from looking at determining the root cause would make the most sense in trying to make somebody better. So I started doing more conferences and learn how to practice functional medicine. And as I did that, I would learn how to do those things on myself, some of the testing, and I would implement that recommended change. And what I would find is that every time I would find something wrong and treat it, I would get a little bit better. And this happened over the course of several years, and everything that you could think of, from my thyroid to severely being nutritionally depleted, and all of my vitamins and amino acids were pretty deficient. My glutathione level was very low. I had severe adrenal fatigue, very little cortisol at all, which no doubt was from the lifestyle that I had been living in, but I just didn't know that at the time. My hormones were very imbalanced, and I had a significant amount of gut issues, though if you'd asked me, I would have told you that my gut was fine. Through uncovering all of those things and treating them, I was gradually getting better, and one day I realized that everything that I had going on was gone. And from there, I decided I needed to stop the medications, because why take them if I was doing better? So I was able to wean myself off of all of those medications and was able to return back to doing the things that I had not been able to do, to enjoying life with my kids, to sleeping thoroughly through the night. I was able to resume exercise, and I loved exercise. I've always been an athlete, and that had been taken away from me. So I was very thankful that I was able to resume that, and actually did very well with it. Major lifestyle changes that I made, my diet was completely changed. I didn't realize how unhealthy my diet was. I kind of grew up that way and didn't realize that Pepsi and M&Ms for breakfast was not what everybody ate when they woke up in the morning. So I did a lot of learning and a lot of growing, and my whole family changed in that, and it was one of the best decisions that we ever made. And from that transition that myself and my family made, that's how I began to practice functional medicine. The light bulb came on for me at that point that if functional medicine has changed my life so much and my family's life, why wouldn't I practice that same type of approach? So it's very rewarding as a provider to be able to do that kind of medicine and be on that journey with the patient. I do feel like that we provide something that no one else here can provide.